Hi, my name is Aleah and I live in Canada. I'm 12 years old and I have epilepsy. In 2031, when this global action plan will conclude, I will be 23 years old. In 2031, I want to become an actress, get married, drive a car, and own my own house. Most of all, I want every person with epilepsy to have medication to stop their seizures. I want this global action plan to make this possible. To all the adults listening, thank you for working together to make my dreams come true.
Thank you, Aleah, for such motivational and inspiring, quite emotional statement. And we are here today to celebrate the approval of the Intersectoral Global Action Plan on epilepsy and other neurological disorders. And it cannot be any other good day than today, soon after the approval yesterday. But more importantly, we are here today to now use this plan to help us, to plan the future we want, the future that makes the dreams of people like Aleah, as she has put it in a statement. And welcome to this webinar, everyone. My name is Action, and together with my co-moderator, Valentina, we have the honor today of co-chairing this celebratory event, and we're looking forward to a good start. And we say the work starts now. Valentina.
The decade-long action plan is very dear to Action and myself. We know very well the challenges that people with epilepsy need to face every day. We have experienced it, and we deeply understand how access to the right treatment and having the same opportunities and rights as others can have a huge impact on the quality of life. I strongly believe that the action plan will make it possible for many more dreams to come true. The plan, approved at the World Health Assembly yesterday and approved by people with epilepsy and other neurological disorders around the world, provides a clear framework for all countries to now work quickly to close the unacceptable treatment and inclusion gaps. Action?
Sure. Yeah, Valentina. And the plan does not only provide a framework for action by just laying the 10 targets that is there, but it also provides us with the means by which we'll be able to engage governments, technical agencies, academicians, professional, patient organization. And, we can hold ourselves accountable to the work that we'll be doing and all the achievements that we'll be doing together, and doing so in using the intersectoral approach where no one is left behind, and more so to say where no person with epilepsy is left behind, or no person with a neurological disorder is left behind. Valentina.
We will now hear more about the Intersectoral Global Action Plan from the World Health Organization. I would like to invite Dr. Devora Kestel, Director of Department of Mental Health and Substance Misuse, to give a presentation. Before she begins, though, I would like, on behalf of all 4 partners hosting this webinar, to thank her and her whole team in WHO for the many years of hard work involved in drafting the Global Action Plan, and for the exemplary, inclusive, and engaging consultation process facilitated by WHO that led to the development of the plan. Dr. Kestel.
Hello, good morning, good afternoon, and good evening. And I am very happy to address you on this occasion. The historic Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders has been adopted by the 75th World Health Assembly. And I'm doing this recorded just a few minutes after the adoption. So we are all very excited. For us, at the World Health Organization, is really the culmination of the work that we have been doing behind the scenes for many years to raise the prioritization and strengthen services for people with neurological disorders. And we were very happy to have numerous member states commend the plan and emphasize the importance of it and the work ahead. We have apparently 116 member states representing all WHO regions and endorsing the plan and commending the Secretariat, which reflects the great momentum built up globally for commitment and close work to reduce the burden of neurological disorders. There are so many people to thank who helped us reach this point, and in our extensive consultations, we spoke to academic institutions, to professional societies, civil society, and we spoke with people with neurological disorders and their families from around the world, and of course, member states officially represented as well in each one of these consultations that we had. And you can see from some of the feedback we received from them on the action plan that we try to make sure that everybody will recognize their own reality in the action plan. So the comments were added in the text and in the action plan. And again, we have to thank all those who joined to give their opinions and who connected us to others willing to share their perspectives with us as well. The action plan, as most of you probably know, has 5 strategic objectives, which focus on prioritization and governance, diagnosis, treatment and care, on promotion of brain health and prevention of neurological disorders, on research, innovation and information systems, and on the public health approach to epilepsy. Each objective contains then actions proposed for the member states and international and national partners to undertake, and then actions that the WHO Secretariat is committing to in order to make these strategic objectives a reality. Each objective also has 2 global targets to be achieved for the period of the plan. Countries then have the flexibility to set their own national targets, and there are indicators to measure the achievements of all those targets. And now let's review each strategic objective in turn. And when we speak about an integrated approach to neurological disorders, this is what it means. In this slide, you have it. We are considering together promotion and prevention, diagnosis, treatment, and rehabilitation through the life course. And also we are taking into account the wider picture of communicable and non-communicable diseases, mental health, and social determinants of health. And the integrated approach includes not only the health system, but also the social care system. And as you know, WHO strongly advocates for universal health coverage, which will make this integrated approach easier to apply. The Intersectoral Global Action Plan is part of our efforts and will be followed in a few months by the WHO position paper on brain health. Moving forward, the case for investment in neurological disorders should also be made clear. And turning the national action plans into action requires a dedicated budget and committed stakeholders. Neurological disorders should be incorporated into government plans and budgeting, and all stakeholders should work to ensure access to quality treatment for people with neurological disorders. We should also work to strengthen all research and data in neurological disorders. And throughout the process, people with neurological disorders, their carers and families should be included in all activities. We want to grow further this engagement when implementing the action plan. and how our work grounded in the perspectives and experiences of people with neurological disorders. This is one of the guiding principles of the plan, and people with neurological disorders, their perspectives and needs should be at the heart of advocacy efforts when planning policies and actions and when raising awareness to reduce stigma and to promote the protection of their human rights. So, once again, thank you for lending your voices to this cause, and I look forward to our journey together in making the aspirations of the action plan into a reality. So the work is just about to begin. Thank you.
Thank you very much, Dr. Kestel, for that overview of the Global Action Plan. And we do share your excitement as well with the adoption today. So we're looking forward working with you towards its achievement by 2021. So without wasting time, we're moving on now to the next presenter. And the next presenter is Professor Helen Cross, who is the president of the International League Against Epilepsy, which represents about 26,000 professionals worldwide, providing care treatment for persons with epilepsy. And now will give us a presentation on the road that we've traveled. Where did we start and how did we get where we are today? So Professor Helen Cross, it's your time.
Hello, I'm Helen Cross. I'm Professor of Childhood Epilepsy in London, UK, and the current president of the International League Against Epilepsy. And I'm here to give you a little historical context as to how we've arrived at this position where we have an intersectoral global action plan for epilepsy and other neurological disorders. It was in 1997 that the International League Against Epilepsy, the International Bureau for Epilepsy, along with the World Health Organization, launched the Global Campaign Against Epilepsy, with the aim of bringing epilepsy out of the shadows, to reduce the overall burden of care and burden to those with epilepsy around the world, to reduce stigma and overall increase epilepsy services to those with epilepsy around the world. Since then, there have been a series of reports and milestones that have moved us forward in our progress in this mission. In 2000, it started the series of regional declarations on epilepsy that actually existed between 2000 and 2003. In 2004, the Global Campaign Against Epilepsy produced the first regional report on epilepsy, and thereafter there were a series of regional reports reporting right through to 2013. In 2005, the WHO with the ILAE and the IBE produced an atlas of epilepsy care in the world as a baseline. And in 2008, the WHO launched the Mental Health Gap Action Programme with epilepsy as a priority condition. In 2009, the first Global Campaign Against Epilepsy demonstration project undertaken in China was published and launched the way as to what difference could be made with such an action. In 2011, two other major achievements, the European Written Declaration on Epilepsy and the PAHO, or the Pan American Health Organization, Regional Strategy and Action Plan on Epilepsy, followed by in 2012, the US Institute of Medicine report, Epilepsy Across the Spectrum. In 2013, the WHO published the Comprehensive Mental Health Action Plan, and again incorporating epilepsy. In 2015, there was an overall recognition of the burden of epilepsy, with the World Health Assembly passing a resolution on the global burden of epilepsy, and the same year, the inaugural International Epilepsy Day by the ILAE and the IBE was indeed held. In 2017, there was the WHO Atlas for Neurological Disorders updated. And in 2018, further demonstration projects, again demonstrating the benefit of intervention, reported from Ghana, Mozambique, Myanmar, and Vietnam. In 2019, the International League Against Epilepsy, the International Bureau for Epilepsy, and the WHO jointly published their report, Epilepsy, a Public Health Imperative, highlighting the degree of problem around the world, whether it be care or research, and highlighting possible ways forward. In November 2020, the World Health Assembly approved the action to move to a draft global action plan on epilepsy and other neurological disorders. The plan to establish a 10-year global action plan to look at multiple gaps, inclusion needs, and the need for research, as well as to establish ambitious, achievable targets and a means of assessing progress, alongside creating a technical report on epilepsy. A draft Intersectoral Global Action Plan was produced from the WHO, distributed for consultation, feedback given, and again, adjustments made, with a draft Intersectoral Global Action Plan eventually going forward to the WHO Executive Board in January 2020, where 80 member states spoke in support of the draft Intersectoral Global Action Plan, and it was passed to move forward to the World Health Assembly for approval. In February, the World Health Organization highlighted the key facts that we needed to address with regard to epilepsy, not least that epilepsy is a chronic non-communicable disease of the brain that affects people of all ages, that around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally. Nearly 80% of people with epilepsy live in low and middle income countries, and that it is estimated that up to 70% of people living with epilepsy could live seizure-free if properly diagnosed and treated. In addition, the risk of premature death in people with epilepsy is up to 3 times higher than for the general population. This said, 3/4 of people with epilepsy living in low-income countries do not get the treatment they need. And in many parts of the world, people with epilepsy and their families continue to experience stigma and discrimination. At the World Health Assembly this week, indeed yesterday, the Intersectoral Global Action Plan was indeed approved. 116 member states spoke in support of the Global Action Plan, and it was unanimously approved at the WHO. So what does this mean next? Well, through the approval, the countries, as part of the WHO, are committed to implementation. We need to move forward to ensure that all countries can gain data on epilepsy services and those with epilepsy in their country, and move toward all national health plans and budgets, including epilepsy services. But with the ILAE and the IBE, we feel there are very realistic targets that we can set, not least that 90% of all people with epilepsy are aware of their diagnosis as a treatable brain disorder, that 80% of people with epilepsy have access to appropriate, affordable, safe, and anti-seizure medications, and 70% of those treated achieve adequate seizure control. Realistic targets over a 10-year period. With the approval of the Intersectoral Global Action Plan, we want to thank the joint efforts of all the epilepsy community. There are some specific individuals that have been involved in this journey, not least Emilio Perucas, Sam Weeb, Thanos Cabanis, and Martin Brody, Shishu Lee, and Aleah, as well as Taran Dua from the WHO. We also want to thank all the partner organisations, including those that are with us today. There also has to be many thanks to all the member states that spoke out in support of the Intersectoral Global Action Plan and the WHO Secretariat for their collaboration and expertise. Thank you.
Thank you, Professor Helen Cross, for your presentation. So much work over so many years. It's humbling to see the long road that has led up to this moment, and of course, the long road now ahead of us all. We started the presentation today with some inspiring words from Aleah. The International Childhood Neurological Association is a global network of professionals caring for children with neurological conditions. Professor Joe Wilmshurst, president of ICNA, will now give a presentation on what the Global Action Plan could mean for children.
Colleagues, thank you very much for this opportunity to present to you today during this webinar on the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders 2022 to 2031. And what we're going to cover during this webinar with our different themes is what's next. Where are we going with this exciting project? I'm Jo Wilmshurst. I'm a child neurologist and currently president of the International Child Neurology Association. And it's been my great pleasure to have been working with my colleagues within the IBE, International League Against Epilepsy, and the WFN with our interface with the WHO in relation to this exciting project on the Intersectoral Global Action Plan. And the topic I'm going to try and cover and talk through with you today is focusing really on improving care for children with neurological disorders in resource-poor settings and how this IGAP potentially interfaces with this. These are my disclosures. So how do we attain universal health coverage for child neurology practice? This is our reality. We should be focusing on prevention, that we need early recognition and intervention for the children we care for. We need accurate diagnosis and effective chronic care. And we can only deliver this if we have a trained and educated workforce. And that workforce has to have the support and the ability to understand their populations, to undertake effective epidemiology, to research the populations they're caring for, to understand what their needs are, and to audit their practice to know whether they're doing the correct management. And only with this information in hand are they then equipped to be able to advocate, lobby, and really target the huge stigma faced by many of our patients. So this is our reality. Here's our child. The child's affected by the background that they're born into, by the direct influences that happen to them as they grow up, and by the available interventions to try and help them. And overriding all of this is their genetic makeup. And the barriers to prevent, to actually help them in the care that have, are massive, affected by ineffective preventative care, the burden of diseases, the disparity between rural and urban and public and private settings, the huge stigma affected by many patients, limited access to facilities, problems with sustainable supply of treatments, and over again, inadequate training across all levels of care. So let's think a bit about prevention. Just looking at the impact from the COVID period alone, this risk analysis found that really the deaths prevented by sustaining a routine childhood immunization program in Africa far outweighed the minor excess risks of death from attending from one vaccination clinic, that they listed figures as high as 84 deaths for one incidental COVID attendance death that might have occurred. And the ripple effect that's happened from disruption in early intervention programs, we will be dealing with for many, many years to come because of the COVID pandemic. When we think about maternal health, this is paramount for healthy babies. Sick mothers result in children with neurological complications. So mothers that have chronic infections, affected by toxin exposure, poor nutrition, as well as poor obstetric services. And it's not surprising that the huge burden for this is often skewed to the resource-limited settings, with the huge disparity in figures illustrated here in Africa and Southeast Asia compared to America and Europe. In many of these settings for the low and middle-income countries, the deliveries are at home without a skilled birth attendant, and it's not surprising that those children suffer the risk of neurodisability related to prematurity, birth asphyxia, and infections. So the International League Against Epilepsy explored this issue around prevention and identified that perinatal insults were the largest attributable etiology for children developing epilepsy. This was followed by traumatic brain injury across adults and children, and then CNS infections. But in fact, in some parts of the world, for example, those endemic with cystic psychosis, the figure would be as high as 34% of causes related to this. And when you combine this data, 25% of epilepsies worldwide are preventable. Thinking about communicable diseases in children especially, sadly, bacterial infections remain a massive problem, and bacterial meningitis, a quarter of the children will have neurocognitive sequelae. In the area that I work in South Africa, we still have pandemic proportions of tuberculosis, and we know that those that suffer TBM, a significant proportion of them will either die or have severe disability. And further compounding all of this, as alluded to earlier, are the problems with access to effective vaccination and vaccine rollout. Similarly, for parasitic infections, 1 in 4 children with cerebral malaria will suffer long-term cognitive impairment. For neurocystic psychosis, without good pig pen management practices and sanitation, you see that this is the leading cause of seizures, where neurocystic psychosis becomes endemic. And there are some very good interventional models that can be promoted and rolled out and supported that can be highly effective in stopping the spread of conditions such as cystic psychosis. So for epilepsy alone, the magnitude is huge, especially in the low and middle income countries. And in fact, the prevalence within sub-Saharan Africa is highest of everywhere in the world, with, again, as stated earlier, perinatal insults driving for children and parasitic infections for adults. The treatment gap is almost 50% across Africa, and when we look worldwide and extended to rural settings, can be as high as 73%. And the messages coming through and the reasons for this are problems with manpower, cost, cultural beliefs about epilepsy, and poor access to anti-seizure medications. So there are huge barriers in the care in key and critical areas. And this is really a good illustration about why epilepsy is a good entry point for targeting many of the areas that we need to address in the care for our patients. But following on from this is the tragedy that has really come to the fore, but I think in reality is not new. And this is a report that we've summarized on the International Child Neurology website, and it really highlights the need to stop the war on children. 1 in 6 children live in areas that are impacted by armed conflict. So this is not just the Ukraine. The Ukraine in some ways threw it up and made us all start being more and more shocked. But in reality, this is not new. This has been going on for many years. This is horrific and this is unacceptable. We are a civilized society, and we would like to think we are. So moving on to another group who are also important and often forgotten, adolescents. And those of us who have adolescents will know that they are indeed a different species, but a very precious species to us. And in fact, their needs are great. So over 1/3 of adolescents are based in countries that are non-communicable disease predominant, with major burdens of mental and substance use disorders and chronic physical illness. And over half of adolescents live in multi-burden countries where the diseases of poverty, undernutrition, poor sexual and reproductive health, injury, violence, and non-communicable disorders. And 1 in 8 adolescents live in injury excess countries. So the messages from this report was that universal health coverage requires accessible packages of care matched to local needs and acceptable to adolescents and young adults. The most effective health service systems, including high quality health worker training, adolescent responsive facilities, and broad community engagement. And that we must create opportunities to extend youth engagement into the real world. This requires financial investment, strong partnerships with adults, training and mentorship, and the creation of structures and processes that allow adolescent and young adult involvement in decision-making. The most effective actions for adolescent health and well-being are intersectoral and multi-component. So let's just think about what can we be doing? What are the available interventions? Well, the problem is that for most of the world, which is surrounded, is basically low and middle income countries, healthcare facilities are really challenged. The distance to travel can be huge, the infrastructure can be inadequate, the diagnostic tools lacking, sustainable treatment unavailable, and the costs of interventions hectic. The site of care for neurological conditions in low and middle income countries is often based in psychiatric units in Africa, and this further compounds the stigma associated with neurological disease. So where should we be heading, and what can we be doing about this? Clearly, primary prevention would be a major starting point, with effective immunization programs, avoiding nutritional deficiencies, managing malnutrition, insecticide nets to prevent for conditions such as malaria, pig pens to avoid neurosycosis, road fences and seatbelts for traumatic brain injury. These are all things that we can do. Diagnosis, so in low and middle income countries, is often limited to basic tests. Can't screen for even the most basic of infective conditions. Neuroimaging, the cost is often prohibitive. So we need affordable, easy to use, rapid diagnostic assays that can be used at the point of care, that can identify, for example, infections early and promptly, and then simple algorithms to help our really overstretched primary healthcare workers with effective therapies and to know when to refer and where to refer. So I'm going to just close with this key point, which is something very close to my heart, about education and training, and a quote from Nelson Mandela, that education is the most powerful weapon which you can use to change the world. So this was some analysis we did a few years ago, looking at how many child neurologists were there in the African setting. And we've changed the numbers slightly, but in fact, the need is still great. So for a population of 927 million, there were 148 clinicians tasked with caring for children with neurological disorders. And this didn't necessarily mean specialists. These were typically pediatricians who had to basically step up and look after these children. So you can see why on World Mapper, it looks at anorexic for healthcare in Africa. So training is needed, and training is needed not just across clinicians. We work in teams. We need hubs of expertise. This is the units that I work in. We train doctors across Africa, but we have a sister organization that trains nurses. And within our group, we've also taken on training rehabilitation specialists and technologists as well, because we work as teams. So how could I close with this? What do we need to be doing to address the gap in healthcare for children with neurodisability worldwide? Preventative interventions will significantly impact on the burden of child health. And the pathway to this is to ensure equipped healthcare professionals, because they can advocate, lead, train, and educate in the local setting to support high-level care across all levels of healthcare and to establish effective systems. So to target areas that will enable universal health coverage and truly produce and roll out the goals of the IGAP, we need to be targeting early intervention. We need to be closing the diagnostic and treatment gap. We need to be encouraging accessible diagnostic tools. We need to be ensuring sustainable, cost-effective treatments, and we need to be promoting chronic care packages. I'd like to thank you for listening and to acknowledge my colleagues that I've worked with in this team from IBE, IGNA, the League and WFN, but also linked to the ICNA, the other child neurology associations who have all supported and agree with the content of this presentation. Thank you very much.
Well, many thanks to you, Professor Jo Wilmshurst, for sharing us the importance of why treatment, care, and the gaps that are there, as well as the opportunities and what can be done. We appreciate so much. Just a reminder to all participants that you're free to send in any questions that you have, so that they can be attended to by the panelists, or they can be attended to when we're having our discussions. Now we're moving on to the next panelist or presenter. And as you know, we've just heard about a neurological condition in the early years, but now we're moving on to a presentation that will help us to know that these neurological conditions, they cover the full life course. And I would like to invite Professor Grisold, who is the president of the World Federation of Neurology, a federation of neurology societies in about 128 countries, to give us a presentation on what it means, what the Global Action Plan means for people with different neurological disorders. Professor Grisold.
Welcome to this webinar on the introduction of the Intersectoral Global Action Plan on Epilepsy and other neurologic disorders. My name is Dr. Wolfgang Grizzold. I'm the president of the World Federation of Neurology, and I have the pleasure to speak a few words on this important event. The topic of the IGAP is epilepsy and other neurological disorders. And there are many neurological disorders, not all of them associated with epilepsy. But the hallmark is that 1 in 3 persons worldwide will, during the course of her lifetime, be affected with a neurologic disorder, which demonstrates the magnitude and importance of this task. The history of the Global Action Plan is outlined here. You can see a side meeting that was supported by the ILAE, by ABE, and gave the initial mark in the development. And it was also supported by several states. In the following years, it was supported in the beginning mainly by Professor Samuel Leiby, by Professor Action Amos from the IBE, and by Professor Bill Carroll from the World Federation of Neurology. It improved, it grew, it was amended, it was corrected, and came to the present form. What is the role of the World Federation of Neurology in this activity? Well, we want to improve the quality of neurology worldwide. And this is one of our mottos and our calls. One of the points how to do this is to improve education or install education if necessary. We have a World Congress of Neurology that will take place next year in Montreal, and it's not only scientifically important, but it's also a large meeting place for many countries of the world. We have e-learning days, and those e-learning days have been developing well, and we had full days on stroke, epilepsy, and headache. From the other several activities, I choose 2 to speak about. One are the so-called department visits, where persons from low and middle income countries can visit a department in Europe or one in Canada, spend 4 to 6 weeks and learn about health systems and about modern neurology. Although this time seems short, it has been a very important stimulus for many. We also have training centers, which are the flagship of our education, that are located 4 of them in Africa and 1 in Mexico. These training centers have 3 of them have a full 4-year training program. In the others, we have fellowships on general neurology, epilepsy, stroke soon, and neuromuscular disease. This is important, and the teaching centers are not only there to teach only, but also to give the local and regional place and university empowerment to increase teaching in the region. What we also intend to do is the development of a core curriculum of neurology that could be used in low-income countries and in those countries which have no or barely neurological structures to implement the basic needs of neurology training. On the right side, you can also see a very new initiative, which is called e-learning hub, and it's a collection of available neurologic teaching programs on our website. Now, doing this is important, but it's not good if it's not known. So one of our roles is to increase public awareness. This is done by the World Brain Day, and you can see the motto of this year's World Brain Day with the topic Brain Health for All. And there will be a webinar on this on the 22nd of July. We have also launched Brain Hash Initiative last year, and you will find some videos, stimulating videos on the website on brain health. And we are also introducing our Global Neurology Alliance that has regional components, specialty groups, and specialty societies to engage in this important activity. And of course, we have media. So this is enlarging the circle, but it's not enough. The World Federation's role is also to influence policy and to engage politicians for neurology, advocating for this important field. On the other side, it is our duty and our task to provide technical assistance to our member societies in implementing the important aspects of the newly emerging IGAP. Thus said, we have to connect, and we are connected with the WHO, which is the lead international organization in this activity. And in addition to this, where we cooperate very closely, we have had previous projects as the Atlas and the ICD. I'm also happy to say and announce that for the first time, the World Federation will be invited to the Economic and Social Council at the UN for consultation. It's called ECOSOC. This is very new, and we will soon report on this. With that, I end, and I just put together that the World Federation, the ILAE, the IBE, and the IEN celebrate this important day of IGAP, and we look forward to the development of the next 10 years. Thank you very much.
Thank you, Professor Grisold, for your presentation, for outlining the history of the Global Action Plan, and for highlighting the importance of improved education and public awareness. At the end of the day, the key marker in 2031 as to whether the Global Action Plan has been successful or not will be whether it makes a difference to the lives of people with lived and real experiences. I would now like to invite Dr. Francesca Sophia from the International Bureau for Epilepsy to speak on behalf of the millions of people with epilepsy.
Hello, everyone. My name is Francesca Sophia, and as president of the International Bureau for Epilepsy and mother of a 12-year-old daughter with epilepsy, I would like to thank the WHO Secretariat and all member states, policymakers, advocates, doctors, and citizens who supported the development of this 10-year Intersectoral Global Action Plan on epilepsy and other neurological disorders, and made it possible to achieve its historic adoption by the World Health Assembly. For this, I am thanking you on behalf of 50 million people living with epilepsy worldwide and their families and friends who have been waiting for decades to see their basic human rights to be recognized, including the rights to health and inclusion. Colleagues who spoke earlier have already told you a lot about IGAP, so I will not repeat. What I will do is to share with you a bit of IGAP history and the next steps from the viewpoint of people with epilepsy. From their perspective, I could describe IGAP as a journey. Certainly, it has been a long journey to get to this day, a journey which is not yet finished. In going through it, we are passing through various stages. First, there has been the dreaming stage. IGAP adoption is indeed the result of the commitment and efforts of people who have a dream. I mean, the overall dream of seeing an unacceptable treatment gap closed and the inclusion of people with epilepsy fully achieved. This broad dream has many facets, and I will share a few to give you an idea idea of the scope of IGAP. In low and middle income countries, for example, people with epilepsy dream of having access to early diagnosis and medicines that will help them live seizure-free. In some of these countries, women with epilepsy dream of being able to marry and not to be ostracized because of their epilepsy. In many places around the world, people with epilepsy dream of getting a job and not to be excluded from it because sometimes they have seizures. They dream to obtain a driving license if their epilepsy is controlled. For parents like me with children with drug-resistant epilepsy, we dream that epilepsy will be prioritized in terms of research funding so that we can see innovative solutions being developed. Then, the second stage of this journey that is bringing us, that brought us actually to today, is about planning. Planning how to realize all these dreams. You know, IGAP planning and preparation required extraordinary effort and relentless work on the part of the WHO Secretariat and all stakeholders. Thanks to the WHO Secretariat for involving people with epilepsy throughout to really capture and address their needs and perspectives. During this planning stage, collaboration and exchange have been key to identify cross-cutting solutions that will benefit all people living with neurological disorders, including epilepsy, worldwide. And finally, as we celebrate today, we know we are already entering the third stage of our journey, which is about implementing the plan. Every country will have to implement their own programs and allocate adequate resources. But before resources, I believe implementation will rely on people's commitment. The IB network is already preparing to support implementation by, for example, scaling up and adapting tools and initiatives that have been already successfully piloted in some countries. Many of these tools have been created to equip people with epilepsy with skills that will enable them to effectively manage their epilepsy and to have their voices heard in contexts such as policy making, research, and care provision. So if I had to answer today's headline, what's next, I will say that after decades of silence and shame for people with epilepsy, I see the next 10 years as a decade of amplifying and empowering the voice of people with epilepsy. My 12-year-old daughter, Beatrice, was diagnosed with epilepsy at the age of 2. Since then, I had to learn to cope with unpredictability, disability, isolation, and the fear of being left behind. I must admit that many times I have been overwhelmed with a feeling of surrender, a feeling that I found in other parents and in many people living with chronic neurological disorders that are often stigmatized. Because, you know, when life challenges you so severely, and tears all your dreams and plans down to pieces, Giving up is always an option, but there is another option which I learned about in making this journey I just told you about, and this is to pick up all those pieces and build new dreams and new plans, and next, make them come true. This is exactly what's happening and what we are celebrating together today. And I thank you very much for making it possible.
Thank you, Dr. Sophia, for that heartwarming and such an emotional message, and you touched the hearts, and you speak, on behalf of the families and people like Valentina, myself, Aleah, and we want to assure you that we will be part of that dream together with you. Valentina.
Yes, I totally agree with your words, Action. I would like to thank all the panelists. All the presentations were really inspirational for us, and you help us to understand better what the Global Action Plan means and the next steps. Now we will now like to invite the panelists to answer some of the questions. We can see that there has been already some questions in the Q&A chat that has been answered, but we would like to take a few more questions now. Action?
Yeah, sure. Thanks, Valentina. And the first question and some comments that have been coming through are to do with working with governments, getting financed for this work. So maybe to the panelists, what are the one or two key things that you think we need to do effectively working with governments to support them in actioning their plans? So you can include the things that we've mentioned. Maybe I'll start with WHO. Dr. Devora.
Yeah, thank you. Thank you very much. And so many interesting comments. And then I will use this question of yours to clarify some of the comments that were written. Yeah. WHO has 194 member states, and all of them endorsed, approved the action plan. All of them. No country was left out of this. Now, 116 countries took the word to say, I want this plan. So just important comment, because it is now on everybody's responsibility to make sure that the plan is being implemented. And in terms of what can be done, if you look at and I invite you to look and read the action plan, you will see that there is a section where for each objective we suggest all together, we suggest what needs to be done by the governments, what needs to be done by all the other stakeholders from civil society and any other organization like the ones today here among us, and also what WHO is supposed to be doing. And so we will, on top of that, we as WHO want to keep working with you all to generate momentum to move on each one of the actions that will be needed and are needed from now on. Stop here to leave it to others.
Thank you so much for your commitment and ongoing support. And Dr. Helen Cross, what's your take on this question?
Yes, well, I think, we have spent many years trying to get epilepsy on the agenda and what, of many governments. And I think, although there's been some success in others and not in other areas, what the IGAP is a commitment with the approval to bringing epilepsy on the agenda and moving the situation forward. As Devora has pointed out, 194 of the number of member states that unanimously passed this means that it has to be on the agenda now within those governments for action. And therefore, we as a community or a professional community can maybe move forward, approach governments at a country level, offer with support, whatever data or other help that may be required in order to meet targets, objectives that are laid out within that agenda. So it gives us some leverage to get that conversation going and indeed move forward over the next 10 years.
Oh, we appreciate your response. And Dr. Jorge, what's your take on how we can work with government and what can be done?
First, let me just explain that I'm here because Dr. Jo Wilmshurst couldn't come here. She's the president of IGNA. But anyway, I agree with Helen and Devora, but I think the first thing we should do is to facilitate and promote participation of local leaders, local colleagues in different countries, especially in rural settings, because only local leaders can engage their governments, so they can stimulate participation of local governments. And this is extremely important to create long-term and sustainable programs.
Thank you so much. A bottom-up approach and yeah, meeting the needs. And I don't know, Professor Wolfgang. Okay.
I'm here. Thank you. Sorry, I just had I was muted. So thank you. First of all, thank you for all these stimulating speeches. And it is so nice to hear that neurology is reaching a global level of being perceived. My take would be 3 points. The first point is to inform and formulate the key questions to our member societies, because it's quite a complex task. And it is important that our collaborators know what we aim at. The second advice would be appear. Appear means in local media, press conferences, social media, to make this known. And the third point, of course, is to infuse and to fuse this development to health authorities and to politicians, because this is a very important way that we have the backup for the future development. Thank you.
Thank you so much. There is need for investment in this work. And Dr. Francesca.
Thank you, Action. There's little I can add to what the other speakers already pointed out, but maybe an important piece of information to add is that I believe, and I'm in keeping with my message during the speech, I believe that a well-educated patient community can be the best ally of governments, policymakers, healthcare provision, and creating healthcare advancements. So the message I would like to leave you today is that the epilepsy community is preparing and training and willing to do so more and more to become your best ally in the next 10 years of transformation and progress. So thank you all.
Thank you, Dr. Francesca, for that response. Valentina, maybe the next question.
Yes, another really important issue that needs to be addressed is a stigma. So many of us question actually how, when there are so many myths and discriminatory laws about the stigma for so many years now, how can we actually tackle this? So now I would like to hear your thoughts. Maybe Francesca, you would like to start?
Yeah, it's a very big question, because stigma is maybe the biggest issue here. I think I can answer with one word. We will need multi-systemic approach. There will be a change when people with epilepsy will gain confidence and pride and education about their condition, but we also need the same change to happen at every level in a multi-systemic way. So it will take time, maybe 10 years.
Yes, I agree. Professor Grisold, do you want
Thank
to
you.
add something?
Yes, thank you. Well, stigma is something that I've looked for many explanations, and I think one point would be a strong disapproval for something that is maybe not rational or it is irrational. And I think we have to fight stigma. I think there are two things I want to add. One thing is that we, in the future, will have to immerse more into different cultures, because in particular in regard to epilepsy and seizures and manifestations of seizures, there's sometimes a broad range of superstition, religious points or cultural points. And I remember having heard from an Indian colleague that nails, glowing nails, are put in the skin to fight seizures in some parts. So it's unimaginable, and we have to invest in that. The third point I want to make is that we realize that diseases, and I'm now speaking for neurology and not only epilepsy, have prestige. On the highest top of prestige are acute medicine. On the lowest are others like, I don't know, psychotherapy. Neurology is somewhere in the middle. And one task that we should have and that we should involve with this IGAP is to lift the prestige for neurologic diseases, which it will involve more care and more attention. Thank you.
That's really interesting. Yeah. Jorge, do you want to add something?
Yeah, thank you so much, Valentina. That's one of my favorite topics. And I just want to add something. My belief is that the stigma comes from ignorance, all right? And so I would say that education is the key, and that should be happening at different settings, including schools. Very early in schools, we have a wonderful program here in the United States, in North Carolina, when we educate middle schoolers, and we ask them what is epilepsy, and at the beginning they don't know. They think it's communicable, and many people know. And once they understand, we can eliminate stigma very effectively. Hospitals, communities, and this should be facilitated by local governments, actually.
That's a really important point. Yeah, education is key here. Now, Helen?
Only to reinforce, education, I think, is really key, but targeted at the different levels, and particularly in local communities, to take into consideration the cultural requirements and engaging the local communities to know the best way to proceed, finding out who is trusted and educating at that level so that disseminates out.
Yeah, it's true. Devora?
Yeah, thank you. Very little to add. Everything has been said. But perhaps then I link it to one of the questions that was written. What do we do in countries without neurologists, for example? And then the integration of all this area of work in primary healthcare will also contribute to fight stigma and discrimination. On one hand, you have more professionals that are going to be able to provide an answer, and on the other hand, it becomes normal, it becomes something that we all can go through, and then that we all can get answers to from those primary healthcare professionals. Thank you.
Thank you for that insight. Action, do we have time for another question?
Sure, just maybe in brief, I would have not done justice if we don't ask this question to all the panelists about maybe data and local capacity. Just briefly, in maybe one comment or one sentence, what can be done around issues to do with data and capacity that you think can make difference, especially in low and medium income countries? Well, I don't know, maybe we can start with Devora.
Yeah, very briefly, we are working as part of the challenge to work with countries, governments to ensure that some basic data is being collected regularly, and the contribution of all the different stakeholders, as we are now here in this panel, to push for those data, to make sure that this data is available, will help monitoring and measuring and improving the situation.
Oh, wonderful. Thank you for that. And it's, yeah, thanks. And I don't know, Helen?
Just to say that I think, in some countries, there is an existing well, first of all, finding out what's known already. Number two, in some countries, there are existing data collection and learning by experience to provide tools to others in order to gain experience as to how they may collect the data.
Oh, thanks. And Jorge?
I just want to add very quickly that we have to recognize that without quality data, it is almost impossible to establish appropriate targets for intervention. So we should stimulate this epidemiological research.
Okay, thank you. And Dr. Wolfgang?
Yes, thank you very much. I think we have now this rich data of the GPD, which is interesting, but maybe this would be a network to increase in details. And I'm saying this as having done several reviews in Europe on some diseases, that often the data from ministries, medical associations, and individuals differ very much. So one task will be to be as accurate as possible and try to use our sources, which in our case, World Federation would be our member societies. And I do think for the ILAE and for the IBE, it would be their member societies, and we would have to find a way to equalize and really trust in this data. But I fully agree that this is one big project that is aligned with our work. Thank you.
Thank you so much. And Dr. Francesca.
Yeah, very briefly, I can only add that I hope that our community will embrace the digital health revolution and will start to look for real world data, real world evidence, and patient generated data, because I think this kind of knowledge will be essential to complement a more traditional data. And so I see our job in the future years to be in the realm of enabling the digital health revolution to happen in every country around the world for the benefit of people with epilepsy everywhere. Thank you.
Thank you so much for those responses. Valentina, maybe.
Yes, no, I'm afraid that now we are running out of time. But I would like to thank all the participants for your questions and comments. And I want to thank again for the panelists for being here today, for all your insights, and also to everyone for all this hard work, because I know there's a lot of hard work behind all of this. And it's really a very exciting time now. So I hope that we continue to work together to achieve the goals of the plan.
Thanks, Valentina. Myself and Valentina, on behalf of everyone, we salute you, our panelists, we salute you, our audience, and we're quite excited looking at the presentations you made, the commitments you make. I know with a team like you, we can't go wrong, and we're looking for the collaborations to work together and make dreams of people like Aleah, mothers like Francesca, and millions other people out there with epilepsy and other neurological disorders, their dreams to become a reality. And we thank you and salute you once more again for everything. And the audience, we also thank you. Now for the final words, I would like to hand over to Professor Helen Cross.
Many thanks, Action, and also to you, Valentina, for your excellent moderation. Thank you to the panelists for their contributions and to all of you for listening and your participation. Just to say that the full recordings will be available from midweek for you to download and use as you require. As we celebrate today the approval of the Intersectoral Global Action Plan, it really has to be acknowledged that this is the beginning. But as we move forward, we should work together with all stakeholders towards a roadmap for implementation for the benefit of all with epilepsy and other neurological disorders across the life course. Thank you for being here.
Thank you and bye-bye.